Welcome to the deep dive. We take the sources you provide and, well, we pull out the most important nuggets of knowledge. Today, we're diving into something that might not be top of mind for everyone, but it really holds profound implications. We're talking animal welfare, agriculture, even public health. Bovine rabies. You've shared a really comprehensive set of materials with us, covering pretty much everything from diagnosis, management, all the way to prevention. So our mission today, to sift through these insights, help you grasp not just what bovine rabies is, but why it's such a big concern and, how we actually tackle it. Get ready for a quick but thorough look at a truly fascinating, if, somewhat frightening, disease. Okay, so let's unpack this. Bovine rabies in cattle. When most people hear rabies, they probably think bats, maybe raccoons,
Right.
wildlife. But it's a very real threat to livestock. So what exactly is this virus we're dealing with?
Well, what's really key here, and frankly alarming, is that rabies is a fatal viral zoonotic disease.
Zoonotic meaning it jumps from animals to humans?
Exactly. It's caused by the rabies virus. That's a neurotropic RNA virus from the lysovirus genus. It's got this distinctive bullet shape, and it primarily attacks the central nervous system. Leads to encephalitis, basically inflammation of the brain.
Okay. And how do cattle usually get it? Is it mostly from wildlife bites?
Precisely. The main way is a bite from an infected animal. Almost always wildlife, think bats, raccoons, skunks, foxes, that sort of thing. Less commonly, maybe if infected saliva gets into an open wound or onto mucous membranes. But bites are the big one.
So once the virus gets in, what happens inside the cow? What's its journey?
It's quite insidious, really. It enters, say, at the bite site, then it travels along the peripheral nerves, kind of creeping its way up to the central nervous
To
system.
the brain and spinal cord.
Right. And that's where it replicates, causes that severe inflammation in the brain. But then it spreads back out centrifugally to other peripheral nerves. Crucially, this includes the nerves leading to the salivary glands.
Ah, so that's how it gets into the saliva to be transmitted.
Exactly. And this brings us to a really critical point, one that's often overlooked. Rabies has this stealthy replication phase. The virus can actually be multiplying in muscle or nerve cells right near the infection site without triggering any obvious immune response from the animal.
Wow. So the animal looks fine?
Pretty much.
Mm-hmm.
But it could already be shedding the virus in its saliva. It could be infectious before anyone sees any clinical signs.
That's huge implications for control, surely.
Oh, absolutely.
Huh.
It means we're often playing catch-up. You don't know an animal's a risk until it's potentially too late.
So it's clearly not just an animal health problem. It ripples outwards, doesn't it?
It really does. Historically, rabies has been deeply feared, and for good reason. It's almost always fatal once symptoms show. And cattle, along with horses and other equids, they're actually among the most frequently reported species globally. That highlights their vulnerability and the huge agricultural impact. In places like the U.S., for example, most livestock cases are actually spillover from wildlife. It's a constant pressure from the environment, which really demands what we call a One Health approach. Integrating veterinary medicine, public health, environmental management, they all have to work together.
And the economic hit for farmers must be significant.
Oh, it's immense. It's not just losing the animal, though that's bad enough. It's reduced milk, reduced meat production. Plus, you get trade restrictions, quarantines slapped on farms. It can be utterly devastating financially.
What about the human risk? How often do people actually get rabies from cattle? Is it common?
Thankfully, it's not common. But the risk when it happens is incredibly severe. Transmission to humans is mainly through contact with infected saliva, usually bite wounds or maybe contamination of cuts or mucous membranes like eyes or mouth.
And in humans?
In humans, it starts often like the flu, but then it rapidly gets much worse. Severe neurological signs, confusion, anxiety, insomnia, agitation, paranoia, terror, hallucinations, and that classic sign, hydrophobia, a pronounced fear or aversion to water. It almost invariably progresses to delirium, coma, and death, usually within a horrifying 2 to 10 days after symptoms start.
Grim. So for you listening, what does this mean for the food we eat? Is our milk or meat supply at risk?
That's a really important question. And fortunately, the answer is mostly reassuring. Processes like pasteurization for milk and thorough cooking for meat, these effectively kill the rabies virus. They inactivate it.
So standard commercial products are safe.
Yes. Consuming pasteurized milk or thoroughly cooked meat, even if it came from an exposed animal, doesn't pose a rabies risk. However, direct handling, and especially consumption, of uncooked tissues from an exposed animal, that can carry a significant risk. So caution is definitely needed there.
Okay, that's clearer. Now, thinking about the infected cattle themselves, you mentioned that tricky incubation period. How long does it usually take for symptoms to actually appear, and what might those first signs be?
Yeah, the incubation period is, well, it's notoriously variable. It can be just a few days, or it could stretch out for several months. Typically, though, we see it around 3 to 12 weeks.
That's quite a window.
It is. And that variability, plus the fact that the early signs are often nonspecific, makes early diagnosis a real challenge. The symptoms don't immediately point to rabies.
What do you mean by non-specific early signs? Like what?
Well, initially you might just see vague signs, things that look like other common illnesses that cause fever. Lethargy, maybe off their feet a bit.
So nothing obviously neurological straight away.
Not necessarily, which means diagnosis can be delayed, and during that time, the animal could potentially be spreading the virus without anyone realizing.
Right. Now, this is where it gets really interesting, especially for anyone working with livestock. The sources talk about two main forms of rabies in cattle, furious and dumb or paralytic. Can you walk us through those?
Certainly. So furious rabies is probably what most people picture. It's marked by really profound behavioral changes. Irrational aggression is key. Affected cattle can become genuinely dangerous, attacking people or other animals without any provocation.
Wow.
You might also see extreme hypersensitivity, reacting strongly to touch or sound. Abnormal, often continuous bellowing. And that excessive salivation, the classic foaming at the mouth.
Okay, that's the furious form. What about the dumb or paralytic form?
The dumb or paralytic rabies, while maybe less dramatic, is actually seen more often in livestock, including cattle. With this form, the animals seem depressed, lethargic, kind of uncoordinated. The disease then progresses to various types of paralysis. Throat paralysis is really common that leads to major difficulty eating or drinking, lots of drooling, maybe choking sounds.
And they don't get aggressive.
Generally, no. And unlike the furious form, animals with dumb rabies typically don't show that fear of water, the hydrophobia. It's a quieter, progressive paralysis.
Beyond those two main types, are there other general signs people should be aware of? Neurological signs?
Yes, definitely. You might see just sudden, unexplained changes in behavior. Ataxia, that's lack of coordination, stumbling, muzzle tremors, holding their head strangely, maybe bowel issues like constipation, excessive yawning, reacting oddly to light, changes in appetite, even things like unusual sexual excitement. And a really common one in dairy cows is just an abrupt stop in milk production.
A sudden drop-off.
Exactly. And once any of these clinical signs appear, the progression is rapid. Delirium, coma, and death usually follow within 2 to 10 days.
This really highlights a massive challenge for vets and farmers, doesn't it? Telling rabies apart from all the other things that can cause neurological signs in cattle. Our sources stress this rabies is a master mimic.
It absolutely is. And this is crucial because so many other conditions can look similar. Relying just on what you see clinically is, well, it's dangerous.
Like what? What are some of the main lookalikes?
Okay, well, take listeriosis, often linked to eating spoiled silage. It can also cause circling, facial paralysis. Looks quite like rabies in some ways.
But the key difference.
Animals can actually recover from listeriosis with antibiotic treatment. Rabies, no.
Right. What else?
Then there's BSE, bovine spongiform encephalopathy, mad cow disease. That shows hyperesthesia, nervousness, aggression. But the onset is much, much slower, weeks to months, not the rapid progression of rabies.
Okay.
Or polyencephalomalacia, PEM, causes stargazing blindness. But often, those animals respond well if you give them thiamine. That's a big clue.
So treatment response can help differentiate.
Sometimes, yes. You also have things like salt toxicosis can cause salivation, circling, aggression, but it's linked to lack of water and too much salt. Various toxic neuropathies, maybe from organophosphate poisoning, certain plants, even tick paralysis. Even common metabolic disorders like milk fever after calving or pregnancy toxemia, or just straightforward traumatic nerve injuries. They can all confuse the picture initially.
That's a long list.
It is. And even something like a retropharyngeal abscess, basically an abscess at the back of the throat, can cause difficulty swallowing and drooling, mimicking the paralytic form. The overlap is huge, which means you absolutely cannot rely on symptoms alone. You need a good history, and you need definitive lab testing. Misdiagnosis is just too risky.
Okay, so let's talk about that definitive diagnosis. Given all those lookalikes, how do you actually confirm beyond doubt that it is rabies?
Right. The definitive diagnosis relies entirely on post-mortem detection of the virus after the animal has died or been euthanized.
So no test on a live animal.
Currently, there are no approved, reliable tests for definitive diagnosis in a live animal. That's a major hurdle. It means suspected animals usually have to be humanely euthanized for testing.
A very difficult reality for producers.
Immensely difficult, both emotionally and economically.
So, for that post-mortem testing, what tissue do the labs need?
The gold standard sample is brain tissue. Specifically, you need a full cross-section of the brain that includes both the brainstem and the cerebellum.
Why those specific parts?
Because the virus tends to be widely distributed in those areas in a rabid animal. Getting both gives the best chance of detection, and proper handling is critical. Collect it quickly, ship it immediately on ice packs for overnight delivery. Sample integrity is key for an accurate result.
You mentioned gold standard lab tests. What are they? How do they confirm it's rabies?
There are three main ones we consider the gold standard. First is the direct fluorescent antibody test, or DFA. This is really a cornerstone. Fluorescently tagged antibodies are applied to brain tissue smears. If rabies virus antigens are present, the antibodies bind, and you see these bright fluorescent apple green spots under a special microscope. It's highly sensitive and specific.
Okay, DFA. What else?
Then there's the direct rapid immunohistochemistry test, or DRIT. Similar idea, using marked antibodies to detect the rabies antigen in the tissue. And third, real-time reverse transcriptase PCR, specifically a test called the LN34 assay. This one detects the virus's genetic material. It's RNA.
PCR sounds very sensitive.
It is. Exceptionally sensitive, specific, and fast. Plus, it can often work even on samples that are decomposed or have been preserved in formalin, which is a huge advantage. It's recognized globally by WHO and WH.
Are there any other tests that might be used, maybe in different situations?
Yes, a few others. Immunohistochemistry, or IHC, can also detect antigens, particularly in formalin-fixed tissues, which is useful if fresh tissue isn't available. A general histologic examination just looking at stained brain tissue under a microscope can show signs of inflammation, maybe Negri bodies, which are characteristic conclusions, but it's not definitive on its own.
What about blood tests, antibody tests?
Right, serological tests. These look for rabies antibodies in serum or cerebrospinal fluid. They're useful to see if an animal has mounted an immune response, maybe from vaccination or past exposure. But, and this is crucial, the presence of antibodies doesn't tell you if the animal is protected, nor does it confirm an active infection right now. It just shows the immune system has seen the virus or vaccine before.
Got it. So post-mortem brain tissue tests are the only way to be certain.
For a definitive diagnosis, yes.
Okay, so let's shift to management. If rabies is suspected on a farm, what are the absolute first things that need to happen?
Immediate action. That's the key, because it's fatal and it's zoonotic. First call, veterinarian. Second call, state or federal animal health authorities. Rabies is a reportable disease, so they have to be notified immediately.
And the animal itself.
Isolate it immediately. Prevent any contact with people or other animals. Ideally, this is done under a formal quarantine order from the authorities.
It sounds like once symptoms appear, you hit this really difficult ethical point.
You do, because once those clinical signs are there, we know the disease is essentially 100% fatal. There's no treatment, no cure. So the focus shifts entirely. It becomes about humane palliative care for the animal, minimizing suffering, and critically preventing anyone else, human or animal, from getting exposed.
Which often means?
Often it means recommending immediate euthanasia to eliminate the source of potential exposure. It's a hard decision, especially with a valuable animal, but often the necessary one for public health.
What about animals that were exposed, say, bitten by a rabid skunk but aren't showing signs yet? How are they handled? Does vaccination status matter?
Yes, vaccination status is critical here. For unvaccinated livestock known to be exposed, the standard recommendation is immediate euthanasia.
Again, a tough call.
Very. Right. Now, if euthanasia isn't chosen, maybe for a really high-value animal, then a strict 6-month quarantine and observation period is mandated. But that's decided case by case with the authorities.
And if the exposed animal is vaccinated?
If a properly vaccinated animal is exposed, the protocol is different. They should get an immediate booster vaccination and then be observed under quarantine for 45 days.
Shorter period.
Much shorter. If their vaccination is overdue, it's more complex, evaluated case by case again. But all quarantine has to be absolutely secure. No chance of escape or contact.
Are there broader movement restrictions, like for the whole farm?
Yes, typically. Farms with confirmed cases usually face quarantine restrictions. Often, no animals can leave until 14 days after the last affected animal showed signs. However, it is worth noting that, thankfully, it's pretty uncommon to see multiple rabid animals in one herd, or to see it spread from cow to cow. So restricting the entire remaining healthy herd isn't always deemed necessary if it was clearly a single exposure, like one animal bitten by wildlife.
You mentioned palliative care. If an animal is showing signs, is there anything at all that can be done to help them, even if it won't cure them?
Unfortunately, no effective treatment exists. Supportive care is purely about comfort, minimizing pain and suffering. Maybe offering soft feeds they can swallow more easily, perhaps anti-inflammatory drugs for comfort, antibiotics only if there's a secondary bacterial infection complicating things.
Huh.
But the hard truth is, treatment is futile for rabies itself, which just hammers home how vital prevention and early intervention are.
What about animal products? Milk, meat from animals that were exposed or confirmed rabid? What are the rules there?
Right. Any tissues or products from an animal confirmed to have rabies must not be used for human or animal consumption. Full stop. Not for transplantation either.
But you mentioned pasteurization and cooking help.
They do. They effectively inactivate the virus. So commercially processed milk, pasteurized, and thoroughly cooked meat are considered safe. The risk comes with direct handling and especially eating uncooked tissues from an exposed animal. That's a potential route of transmission.
And for slaughter.
For custom or home slaughter, if an animal was exposed, it must be slaughtered immediately after exposure, and all tissues have to be cooked thoroughly. Commercial operations have strict protocols and must notify public health officials.
Makes sense. And for the people working closely with these animals, vets, farm workers, what personal protective equipment, PPE, do they need?
PPE is absolutely non-negotiable because it's zoonotic. We're talking gloves, definitely. A face covering, or better, a face shield, eye protection, a protective smock or lab coat, and an N95 mask is important too, to prevent breathing in any potentially infectious aerosols.
And if someone does get bitten?
Immediate, thorough washing of the wound with soap and water. Lots of flushing. Then, immediate contact with a doctor and local public health officials. They will assess the situation and likely start post-exposure prophylaxis, or PP. That's a series of shots, and it's incredibly effective at preventing rabies in humans if started promptly after exposure. Critical step.
Okay, so prevention is absolutely paramount here. What are the core strategies? How do we stop cattle getting rabies in the first place?
Vaccination. That's the cornerstone. Consistent vaccination programs should be part of routine veterinary care for cattle in areas where rabies is a risk. And it has to be the right vaccine, USDA-licensed, inactivated, monovalent rabies vaccines, and administered correctly by or under the supervision of a licensed vet.
Is there a standard schedule, like for calves?
Yes, the general recommendation is a primary vaccination around 3 months of age, followed by annual booster shots. An animal is typically considered properly immunized about 28 days after that first shot. And sticking to the licensed protocols is really important. Going off-label might mean the immunity isn't as strong or reliable.
Should all cattle be vaccinated, or are the specific ones to prioritize?
Ideally, in endemic areas, yes. But practically speaking, certain animals are higher priority. Definitely any livestock that have frequent contact with humans, think petting zoos, animals at fairs, that kind of thing. Vaccinating them creates a vital buffer against human exposure.
Good point.
And also valuable livestock.
Mm-hmm.
Breeding stock, high-producing dairy cows. The economic loss if they get rabies is huge, so protecting them makes financial sense too.
Vaccination is key. What about biosecurity on the farm itself?
It's hugely important because remember, rabies in cattle often comes from wildlife spillover, skunks, raccoons, foxes, bats. So biosecurity involves deterring wildlife. Keep feed areas clean. Don't leave spilled grain around. Remove potential wildlife shelters, piles of junk, old lumber, derelict buildings. Make the farm less attractive to them.
So it's partly about managing the farm environment.
Exactly. It's an ecosystem approach, really. And basic farm hygiene helps too. Regular cleaning of water troughs, feed bins, proper disposal of any dead animals, cleaning equipment between animals. These things help reduce the overall disease load on the farm, not just for rabies.
What about animal movement? Bringing new animals in?
That's another critical control point. Limiting contact between your existing herd and any new or returning animals is key. A closed herd where you don't bring in outsiders is the ideal, but not always practical.
Right.
So if you do bring in new cattle, they absolutely should go through a quarantine period. At least a month, maybe 21 to 30 days is common. Keep them physically separate. Use separate feeding gear, even separate boots and coveralls for handling them. This acts as a buffer, giving time for any incubating diseases, including rabies, to potentially show up before they mix with your main herd.
It really sounds like rabies control isn't just one person's job, is it? It involves the whole community.
That's exactly right. It goes way beyond the individual farm. It requires broad public health action, community education. Public awareness campaigns are vital, teaching people to avoid contact with wildlife, report stray animals acting strangely, report potential exposures. Vets and others at high risk should consider pre-exposure vaccination for themselves.
The human vaccine.
Yes, and reinforcing that message. Any potential human exposure needs immediate medical attention and public health follow-up for PPU. It truly is a shared responsibility. It needs different agencies, agriculture, public health, wildlife services, all collaborating.
This whole deep dive into bovine rabies, it really drives home that one health idea, doesn't it? How animal health, human health, the environment, they're all completely tangled together.
Absolutely. If you look at the bigger picture, it shows that even though we have pretty good prevention tools like vaccines and solid management strategies, the fundamental challenges persist, like not being able to reliably test live animals.
Yeah.
And that constant link to wildlife populations. It keeps rabies a relevant threat.
Yeah, it keeps you on your toes. Which brings us to a final thought for you, our listener, to maybe chew on. What if? What if we could develop really effective, large-scale ways to vaccinate wildlife populations, maybe through oral baits dropped from planes, that sort of thing? Or what if we invented a reliable, fast diagnostic test for rabies that actually worked before an animal got sick? A live animal test. How might breakthroughs like that fundamentally change things? Not just for livestock and wildlife, but maybe even easing some of those big economic burdens on agriculture worldwide.
It's definitely where future efforts need to focus. Continued research into better diagnostics, especially antemortem tests, improving vaccine effectiveness and delivery, particularly for wildlife, maybe even exploring novel technologies like gene editing for disease resistance in livestock, though obviously there are big regulatory hurdles there. But yeah, innovation is key.
Lots to think about. Thank you for joining us on this deep dive into bovine rabies. We really hope you feel more informed and maybe better equipped to think critically about this important, complex topic. Until next time, keep learning.